farmers, by the farmers. So we are lucky that we are having these two EVM experts with us, and there will be a technical feast on EVM, which is a sort of a Indian prayer we had in our Vedas. Ayurvedic knowledge, you can say, but that was lagging. That was not going, and hand-holding was not there. That was not being passed to the generations, and there was a gap. Now we have discovered that thing, and so we want to enrich you so that we can have the alternative medicine, we can have the cheap medicine, economical treatment, so that the farming becomes affordable, sustainable, and the farmers which are at the crossroads, they can be helped, they can be bailed out in such a lot of price rise in case of concentrate or many things. Everything is costly, so we have to help them. That was the aim, and with the material in our garden, we can help them. They can use those things and can treat the animal without chemicals into the milk, which is going to the society. So I will have the brief biodata of Professor Dr. Punyamurthy ji. Basically, Professor Pharmacology. In Tanvas, he has retired from there. Now I can say he's a free Lancer veterinarian and EVM consultant, global EVM consultant. And he was director for this Tanvas PG diploma in Ethno medicine that was started in 2011, first time by the Tanvas, so in collaboration with Foundation for Revitalization of Local Health Traditions. And then he has a scientific validation of more than 400 herbal practices on various diseases related to FMD and lumpy skin disease, pox, gastric disorders, reproductive disorders, especially feed feeding and retention placenta. Farmers give hand holding and advising them. And he is there to NDDB, DSD, ICAR, and many schemes. And the Tanvas especially sanctioned 13 crores for the herbal product development, which is over a line over there. Just you can have a look on those products that has been developed by the support from the Tamil Nadu government. And he is practicing telemedicine and outreach and basically connect with the farmers. A lot of awards, he needs no awards, a lot of awards are after him, and he is also practicing the One Health concept. The basic what I could read from the Google or seeing his book, lot of books he has published. I say any emergency there are three king concept. The king of land is the beetle leaves, not the beetle, not the goats, the beetle palm. And the king of mountain is the pepper, black pepper, kali mirchi. And the king of sea is a salt, common salt, that is table salt, a source of sodium. Like Ramdev in yoga, Dr. Punyamurthy is in EVM. So we must clap for him. He has redefined the veterinary practice in India, and his aim is to have we used to say milk is a nectar. Milk is a nectar. That nectarness has gone, a lot of synthetic milk, vegan milk, many things are coming to the market. So his aim is to have again the milk like nectar, egg, nutritional rich, egg and meat, and the antibiotic-free livestock farming without insecticide, pesticide, residue, so that we do not play with the health of the people. Sir, for the information of the sir, I during my doctorate program, I have the opportunity to work on the entomological pharmacology. We used to inject the paracetamol, oxytetracycline, and naproxen continuously in breeding bulls for 7 days, and we collected the semen for a complete spermatogenic cycle for 62 days. Astonishingly, the paracetamol was having the adverse effects, and it was excreted in the semen for around 50 days. Then come the oxytetracycline that was excreted in the semen for 30 days after the last injection, and the endoproxacin that was excreted for around 20 days. So the WHO says paracetamol is a safe drug, but it is not safe. And a report says if we take a one course of paracetamol, it takes around 5 years to complete wash out from the body. So you have to think before taking any this paracetamol or any such drug. And I think few days back we had the telesurgery, and the operation was performed in Gurgaon, and the surgeon was sitting in the Hyderabad, 1500 kilometers away from the operation. So that is the speed of the science. But with that speed, we should not move. Of course, we should move, but we should have the knowledge of our trial, the Ayurvedic knowledge, the cheap treatment method we must know, and that is the topic we will be talking today. And the audience profile is we all the 72 are the interns, and they are in this internship from last 5 months, still 7 months to go, and others are the senior faculty members from the college. And so we'll be having the technical piece on ethno veterinary medicine. Punjabi you might not be able to understand, but still I will share. You are lucky one, you are able to get that type of knowledge from the Khalsa college. एक दूजी भी कहावत है, कहते गुरु में गाते शाह में पत नहीं, माँ में जाते नहीं, तो पढ़ाई में मत नहीं. So we need to have that knowledge that is only possible through the such a towering personality guru. So I welcome Dr. Punyamurthy for this very important talk on
So very good afternoon, budding veterinarians, the founding father of this very exciting legacy of institution, Khalsa Veterinary College, Dr. Nathalji, Principal Dr. Raji, my learned colleagues Dr. Sharma, and learned experienced colleagues from this wonderful campus, my good friend Dr. Kulkarni. I'm basically a farmer with animals at home. And you study different subjects from stalwarts from first year onwards till date you learn something. There is only one examiner who will make you really sweat is the farmer, because he knows what questions to ask. Probably we may not know the answers. So last evening, the calf is having diarrhea. What will be the color generally? Slightly yellowish or whitish curdle. So most likely due to excess milk. So it would be unethical, among crime if you give sulfur with bolus, or even sometimes they will go and ask, they will even give a furosemide bolus. So this is where the traditional knowledge comes handy, because you cannot tell the farmer who gives anything, we have to save the animal. So there are management issues, like you try to allow the young one to circle early in the not the final stages, so that there's more fat in that. Don't allow the animal to lick mud, because licking mud, licking the mother is part of the human development. So you have to take everything into account. But finally, waste mixed with food and apply over the tongue and make other arrangements. Within a day, the animal the cow will become alright. Suppose it is a 3-month-old cow. You take eggplant, brinjal, barbecue it, 2 pieces, cool it, add guava leaves, and then curry leaves. Make a paste with food and apply. 3 months, the animal is trying to develop the rumen from 10% to almost 90% of its gut occupancy, and then get ready to digest or facilitate all inedible materials from the agri side. So this is what the human development is all about. So here we see using natural products which will help in containing